Well, good evening, everyone. I'm sorry I am a couple minutes late. This is Dr. Ella Thorpe with Tustin Longevity, Ask the Doctor, and we are here to address your questions, your concerns, your ideas about what to do for preventative health and how to establish lifestyle, New Year's resolutions for your health and things of this sort. But this is generalized information. This is not meant to be individual advice on your personal health care. If you are a patient here, we would like you to call the office at 714-544-1521, and then either text at that number or call and leave a question or speak to the front office staff, and we will get back to you to address your personal question. That way your healthcare provider and the team can look at your chart and address things. And as much as I would like to, I don't recall necessarily by seeing the name or your handle if you're a patient or not, and I would still not give you personal advice over the YouTube. In general, there are so many questions out there in the internet, many very good videos, podcasts on healthcare, and we don't represent that we have all the answers. If I don't know something, I will tell you I don't know. But after practicing medicine 41 years myself, and along with our team here of 7 healthcare providers, we do have a lot of information and support in regards to trying to address your health concerns from a more functional preventative point of view. We are meeting monthly. In fact, today was a very busy day because we had our monthly clinicians meeting where all 7 of us and some guest doctors come to visit and see how we practice what we call our grand rounds. And we asked them what they thought. And Dr. Yu was with us today. He's a rheumatologist. And he and his wife, who's a family practitioner doctor as well, they're setting up their practice. And they're very thrilled to know that there's a team of healthcare providers here with years and years, decades of experience who are willing to openly share and provide any means we can to help them or mentor them as well. So long and the short of it, we are here for you. And if you have any questions and you're on YouTube, you can type your questions into the chat over on the side, and I'll try and get to them. Normally, I can get to all the questions. The other thing we have is, and that's why I was a couple of minutes late, we have emailed questions that are sent in to the link below at the bottom here that's address your questions, so it's clear to know that this is being sent to the Talk to the Doctor for our our Tuesday night, 6 p.m. Talk to the Doctor every Tuesday night for an hour. And then I'll go through these email questions, and then we'll go to the chat over here. And let's get started. The first question I have today is from, let's see, who is this? Christina. What would cause sudden weakness in thighs? I can walk, but feels a little weak. It has happened twice recently, then is followed by anxiety and diarrhea. Thank you and God bless. Well, Christina, much of this would depend on many questions I would have. How old are you? What medicines are you taking? What is your background medical history? What is your lifestyle like? What is your body habitus look like already? What are your recent history of any exposure to the mRNA injections? There are so many questions I would ask you. A sudden weakness in thighs that is intermittent needs to be addressed by a healthcare provider. It could be as simple as just getting older and having gradual muscle mass loss. From age 40 on, we lose about 1% of our muscle mass per year. And so you could be getting older, losing muscle mass, gaining weight with age, and having a diet maybe that isn't adequate enough in sleep and water, maybe other issues. And then you're going to start finding out that any kind of a mild illness, viral illness, can really amplify your mitochondrial, that's the number of cell batteries, you might say, in every cell is diminished. So there are so many things that could go on, Christina. I would like to ask you to see your healthcare provider so that they can see you physically and by age and by your body habitus and by what medicines you may or may not be on and what recent viral illnesses you might have had, what recent injections you might or might have not had. And look at these things along with your lifestyle and start putting together whether this is just age-related and functional or whether it could be a sign of something more serious. So I don't want to go in and create concerns or anything, but intermittent weakness, that's bilateral because you're saying thighs, usually I would say would be more on the metabolic side. But there could be neurological issues, and we need to address this. So do see your healthcare provider, Christina. The next question is from Caroline. What did your opinion of low-dose immune therapy for rheumatoid arthritis? Some people are getting injections for rheumatoid arthritis on periodic basis, and I've seen this be modulating to quiet down the immune system. Usually, rheumatoid arthritis is an autoimmune disease with an imbalanced immune system, so I'm not against it, Caroline, but I certainly wouldn't use this unless we had done and laid a groundwork for all the baseline healthy lifestyles, such as hydration. Over and over again, I'm going to be reminding you how important water, delicious water is. Your body is about 70–80% water. And for arthritis or any form of inflammation from any cause whatsoever, water needs to be a foundation. And then as we get older, systemic enzymes to reduce inflammation, and we need to exercise and to move around the lymphatics. A rebounder would be very good. Another thing would be taking the enzymes along with a low-carb diet and ruling out food allergies. The ultimate elimination diet is a carnivore diet for a season of your life, maybe 3 months. And then looking for vitamin deficiencies, mineral deficiencies, looking at toxic exposures, heavy metal toxicities. All these things should be done first, and look at your general health before you would do this. But my opinion of low-dose immunotherapies that are given usually intravenously are not something that I would say no to, and I'm not a specialist rheumatologist. I would instead say make sure that you're doing all these other things first. Dorothy says, can you explain all the effects of the rebounder on the muscles, joints, and whole body? Well, I don't know if I can explain them all, Dorothy, but in general, the history of the rebounder, which is this trampoline, it's about a 3-foot diameter. Maybe it's got about almost 20 inches of a trampoline pad in it. It usually has a bar on it for older people for balance, safety issues. They can hold on or have the bar right there. We have lymphatic systems that have no muscle, and fluid drops by gravity dependently. And you can get lymphatic buildup in your lower extremities. We start seeing ankle swelling with aging, prolonged sitting, like when you're on an airplane. And if you're not doing regular exercise to keep your tone, your muscle mass, because muscles, when they contract and relax, are themselves a bit of a pump for the lymphatic system. Laying down with a good night's sleep is another methodology for getting the lymphs moved from the lower extremities and bottom half circulated, getting good night's sleep, drinking enough water is important, having your enzymes. But if you get on the rebounder and you just bounce on it, several minutes, 5 to 10 minutes, twice a day, this is a systematic, rhythmic, muscular, low impact scenario where your muscles are contracting and relaxing cyclically, much like pumping or milking, your lymphatics throughout your body. When the lymphatics that are involved in your body cleaning, your body elimination of waste, that always amplifies every cell function in your body from your brain to your toe, because every single cell in your body has to excrete toxins. And one of the ways we measure this is by doing a homocysteine reading, or looking at your sedimentation rate, or looking at a urine-specific gravity as to how concentrated your urine is. So again, drinking enough water is important. A lot of women who can't go out and exercise because they've had vaginal deliveries and they don't have as good control of their urine, they stop exercising because they start to leak, and they're embarrassed in group or gym situations where they can't go and exercise without leaking and pads and the smell. So it's nice to have a rebounder at home where you can get that rhythmic whole body lymphatic massage, and you could stop anytime you want, go to the bathroom, empty your bladder, or change your pad if you're leaking, and then get back on to your exercise and rebounder. So I like an in-home rebounder, especially for people as they get older. But again, it was originally developed for space, for exercise, to help the bones to get some deceleration, sudden deceleration with every bounding stop. And that will pull on the periosteum of the bone sheath. Every bone, like cellophane wrapping around a bone that the tendons attach to, and then the muscles pull on that sheath. And that sheath is right connected to the minerals of casing, you might say, structure of the bone cells, and talks to it electrochemically, especially with a stress pull, and tells it to stay healthy and repair. So from muscle strengthening to pulling on the periosteum of the bones, to massaging the lymphatics, to teaching your body balance and nerve proprioception, all these things help with the rebounder. Narita says, for those interested in detoxing their bodies from vaccines, is there a detox protocol that can be followed? I've read some doctors recommend a parasite cleanse along with hydroxychloroquine and ivermectin. I suppose you could say just drinking water is detoxing, because most Americans do not drink enough water every day of your life. Whatever your pounds are in weight, drink that half of that as water every day, maybe 10% more. But if you're talking about things that we know that help to get rid of excess spike proteins, and that would be enzymes, that would be quercetin, that would be EDTA chelation therapy, that would be even high-dose vitamin C therapy to offset the oxidative stress. That would be taking in a diet with healthy fats, essential fats that make up the cell membrane. Remember, your cell membrane is a double layer of fats, okay? And here's where an injury is on that cell membrane. And if you can imagine all these holes poked in on each cell membrane by a spike protein that needs to have that repaired. So you have to get enough fat, healthy fats, linoleic, alpha-linoleic acid. You have to get in the protein to repair that cell. And if your capillaries that bring the blood flow nearby that cell are clogged up with a high carb, high food allergy antigen antibody complex, not enough water, not enough exercise, not enough rest and repair, along with poor diet absorption, then you're going to have trouble. So everything matters. The water you drink, taking in the repair materials of the healthy fats, and these are in our wild caught fish, beef, prairie raised, and chickens and pork and such. This will give you these fats plus the protein. It'll also be low carb. And the other thing is taking in systemic enzymes, because we lose this. We lose our systemic anti-inflammatory enzyme production with aging. We lose our production of digestive enzymes with aging. Getting a good night's sleep, and then adding in things such as ivermectin or hydroxychloroquine to really depress the viral stress on the body, as well as taking quercetin, which acts as an ionophore. That means helping zinc to get through the cell membrane so it can suppress the ribosomal production of virus in the cell. And so zinc is a very important antiviral agent many Americans are very low in. Taking enough vitamin D in to helps with your protection of your immune system and as an antiviral agent. Taking enough vitamin C in, high-dose vitamin C drips. EDTA chelation acts as an anion. The spike protein pharmacokinetics has been reported that I understand it to be a cation, which is positive. So it means that the negative anion of EDTA can attract the positive cation of the spike protein. Enzymes can act as little Pac-Man to try and chew it up. The water in your diet can help move it away. The exercise can help move it away. The good sleep at night can help you with restoration, healing with these healthy supplementations. So I'm all for those things. In fact, in our clinic here, no one's been hospitalized. No one has passed away. And even those, about maybe 15% of my patient base that I've seen has been injected with the mRNA gene technology. So that I would say some of them had strokes, some of them had 2 strokes, but they've all recovered and they've all done superbly well. But they all were doing these things with EDTA chelation with vitamin C intravenously. So very often I have them on the ivermectin twice a week, or the hydroxychloroquine. And we monitor their clotting, their D-dimers, their HSCRP, their sedimentation rates, and they're very low carb. So that's what I would say, Narita. Debbie asked the question, my adult grandson came down with a sore throat on one side last night. This morning, his throat looks a little red, and on one side, there may be a small pocket. Just a moment, I have to get something off the screen here. A small pocket of infection. He has been drinking hot tea gargled with salt water today. What would be the best thing to do, and which supplements should he take? Well, I would use Argentin Silver. Argentin Silver comes as a liquid. It is in, let's see. That's Argentin Silver. And this is an eyedropper. And I will put a drop in my eye, each eye every night. This is the nasal spray. I will spray my nose every night. This is a mist. So you can, spray it. Let's see, maybe if I do it against the black hair. No, I don't think you can see it. But anyway, it's a spray. You can you can spray your throat, or you could take a teaspoon of it, swish and gargle, and then let it swallow down. Vitamin D, I would take vitamin D. We have the 50,000 capsules, and you could take one a day for 5 days, and then go back to your 5 or 10,000 daily average dosing. I would take powdered vitamin C. It's called Vitality C. I don't have it here, but anyway, Vitality C. You take a scoop, put it in your water, and I drink that in the morning. Then another thing would be you could take the the zinc, which is in the TLC multi-minerals capsules, 3 capsules a day. That would give you your zinc, your C, your D. And remember, Argentyn silver works as a antibacterial, antiviral, and antifungal. Now, this is if he's feeling overall well, but if he starts getting worse and with a fever, then he needs to be seen and evaluated by a physician. But in general, adults don't tend to have group B beta strep, group A beta strep, and this is the one that causes the strep throat of concern that can give you heart disease. So I would assume in the adult male, when you say adult male, I'm assuming he's in his early 20s or older. You could get a group A beta strep in your early 20s. So you'll have to follow this, but most pharyngitis sore throats are viral, and or they can be acid reflux at night, as what we call a silent reflux or laryngitis, and this just needs to be followed. If these simple measures, along with a low carb diet and plenty of water, don't solve it, then he has to follow up and be evaluated by a healthcare provider, especially if he becomes with fever and other symptoms. James says, my right eye has a problem called epiretinal membrane, aka macular pucker. I'm 69 and otherwise healthy and not on any medicines. My left eye is fine and I can still read without glasses. I am short-sighted and need glasses when driving. Thank you. So what I guess the question would be, having some epiretinal, meaning above the retina, membrane puckering. Okay, so if the eye is if this is where the pupil is and you're looking out this direction, and then if I turn the eye this way, then the pupil would be here and it would be looking straight at you. So the covering of this is the retina membrane, and apparently a part of it is puckering out. So you have to ask why. Well, you have to understand physiology, and we know that with age, we are making less collagen and elastin. We are making less muscle mass. We are wrinkling, and this is another way to say a macular wrinkle, and so a autophagy would probably be the first thing I would do. I just came off last week my 5-day fast. I fast from the 1st of the month through the 5th, 6th of January. And I do this twice a year. Throughout the month, I will eat only 1 meal a day very often. Sometimes I'll miss a 24-hour and wind up being 36 hours. Very, very often this will happen with my busy days. What this means is that my body, through this fasting times, especially when I do a prolonged fast of 3 to 5 days or more, I wind up getting into a state which is called autophagy, where it chews up debris, it chews up wasted materials because I'm not bringing anything in. And so the body starts, so to say, cleaning up waste material, even amyloid plaque that might be in my brain that would eventually build up to the point that it would lead to dementia and Alzheimer's. So the other nice thing about it is it helps diminish your wrinkling on your body. Okay, so at 70 years old, I should have, I think, probably many more wrinkles than I really do have, and I can only assume that this autophagy would help get rid of that pucker there. So under the care of a doctor, because I don't know who you are, James, and I never recommend prolonged fasting to anyone unless we know them medically and where they are metabolically. But prolonged fasting is quite safe and quite common. And I do it twice a year and intermittently fast every day of my life, meaning I never eat breakfast. So I always am on an 18-hour fast, and I eat between noon and 6 p.m. So my body is already primed. The minute I start to fast even longer than 18 hours, my body, if I eat well, is ready to start catabolizing itself, breaking down unnecessary or mismatched proteins or older cells, which will create a stimulus for new cell and remodeling and repair. The other thing is, of course, you need to be low carb on that, James. The other thing is you need to drink enough water to rinse away the debris and enzymes, which are the Pac-Men that eat up the debris. For instance, I had a, what do you call it, a floater in my eye. Oh, I don't know, last year sometime. I woke up with it one day. It was quite dramatic, quite annoying. And I knew right away that I needed to go on a 5-day fast. I did that and it got dissolved away easily, maybe 80-90% of it. And that just is a testimony to self-healing and autophagy, and taking my enzymes and drinking enough water and keeping those sugars low, because whatever is gummed up in our body in general, your body senses that it's abnormal and needs to be addressed and cleared up. So that's what I was saying on that, James. Tiziana, hi, Dr. E. Happy New Year. Happy New Year to you, Tiziana. My 85-year-old father, who lives in Italy, has prostate cancer. His oncologist opted for hormonal therapy, and he gets an injection of 10.8 milligrams of glycerolin acetate every 3 months, which gives him hot flashes as a side effect and makes him very uncomfortable. He does not drink or smoke, never has. Is there anything he can do or take to help with the hot flashes? Thank you. Well, this is because this hormone therapy blocks the testosterone to bring the testosterone way down as a method of having the prostate cells not be responsive to any hormonal signal from testosterone. But that sudden drop creates this, and we don't quite totally understand what the climacteric hormonal reaction is about in menopause or in men who are having chemical hormonal ablation through injection. This is getting rid of your hormones, you might say, through an injection. But that sudden change creates this sensation of hot flash, sweats. So this vascular activity is not quite well defined. So what we give women who are on estrogen blockers like tamoxifen and other agents to block estrogen, we use plant-based items like black cohosh, dong quai, ashwagandha, which isn't a blocker, but it is a herbal kind of mood stabilizer. We give them magnesium, extra magnesium, and potassium and calcium. We give them vitamin D to get their levels to about 100 nanograms per deciliter. And we tell them to drink plenty of water and to exercise and get a good night's sleep as best as possible. If necessary, use melatonin to sleep at night. These are the things that we give: dun quai, black cohosh, ashwagandha, vitamin D, magnesium, potassium, and calcium, and melatonin at nighttime. And often this is a big help. So hopefully something like that would be a help to your father, Tiziana. Zola says, how relevant is folic acid as a supplement for heart health? Should folate levels be monitored before and after supplementation? Thank you. Um, Zoila, I've never seen that as any serious concern. Folic acid, I just have never seen that in my practice over these 40 some years. And I would say it would be difficult unless you're actively supplementing with a folic acid only, that it would be in any very elevated range. And even if it was, I don't think that that would be much concern. It is the low folic acid levels that I have more concern about having metabolic symptoms develop from it. So this B family type vitamin is something that is in meat and your fish and your vegetables. And so it really isn't something that you have to worry too much about supplementation. You can measure it on a lab test, but I don't usually ever prescribe folic acid because I have never found it as one of the real feature elements of deficiencies. Most good supplements have folic acid in the multivitamin supplements. Most B complexes have folic acid in it. A good B complex will all have methylated B complexes. And so I don't think it is a major issue for heart health in and of itself. It's such a uncommon thing. At least in my practice, I haven't seen it so. Constance says, can't thank you enough for the time you devote to your patients and others' wellness. Well, thank you, Constance. We do love our patients, that's for sure. And God certainly loved you so much, He died for you. And so I need to treat you with that same passion that our Lord had for you. So she goes with the question. She saw a urologist today who was 20 minutes late for me, her first appointment. And after 10 minutes, she said she had to go because others were waiting. She gave me Premarin as a remedy to stop from getting up 3 to 4 times during the night to urinate. The side effects seem disastrous. Your opinion? Well, Premarin is a horse estrogen. It's designed for a 2,000-pound horse. It is a estrogen-like feminizing, but for a horse. It is not in a human form. There is no estrogen that a horse makes that a human woman would have in her. So I don't like Premarin. I've never liked it. And I would instead suggest that you get natural hormone replacement therapy from a doctor who is familiar with, your whole being, who you are, how old you are, what your lifestyle is like. Because I won't give hormones to women who are not going to take care of their health, drinking enough water, doing some exercise, being on a low carb diet, and they must take systemic enzymes. Because if we're going to allow you to have the benefits of your youthful hormones, then you better have some of the habits of a youthful people. And one of them is exercise, drinking enough water, and a lower carb diet, and using enzymes, because young women have tons of enzymes in them, older women don't. So Premarin is a horse equine derivative. It is designed for 2,000-pound horses. It is not what I would give any human being. And that's how I would state that. So there you go, Constance. Let's see. Debbie says, "Hi, Dr. Elifer. What is your opinion and eating organic soy to help fight breast cancer? Thank you for what you do." Debbie, I don't believe eating organic soy helps fight breast cancer. The theory is that soy acts like a little bit of estrogen in its biochemistry, and it'll be attracted, in theory, to the cell receptors for estrogen. And by doing so, they will block the real human estrogen in the body. So it acts as like a blocker of estrogen. But in practicality, I find, and have been around this for 30, 40 years, seeing all form of soy concentrate from organic sources and women taking this, and I have never, ever seen it make a difference. And I have followed some of these. I've traveled out of state to go to lectures on this and see healthcare practitioners who have tried some of these hyper concentrated organic soy things, and it just didn't make any difference. Now I'll tell you why. Because unless that woman is low carb, the real hormone that needs to be blocked is insulin receptors. And cells have more and more insulin receptors the more and more your high carbohydrate, starch, and fruit sugars are consumed in your lifetime. And so with increased receptors for insulin, that is the biggest, strongest growth stimulator, fat stimulator, blood vessel thickening stimulator, tumor promoting stimulator. And until we have every single doctor on the planet discussing the number one hormone that's associated with cancer, tumor growth, fat growth, heart disease growth, diabetes growth, then I think they're foolish, and they're just not addressing the real issue and trying to sell a product. So that's my opinion on soy, Debbie. Thank you for your question. Lisa says, "Blessings for this year, Dr. E, and thank you for continuing to educate and inform us with your busy schedule. In November 22, I packed up tiny individual bags with 5 Immune Protect and 150,000 international unit vitamin D for each for a trip, okay, I was taking, just in case I caught a bug." All right, that was a smart thing to do. Thankfully, I did not. How long are these vitamins still good to use out of their containers? Is it as long as the container says, or for a shortened amount of time? No, I would say if you kept them sealed in a plastic sealed container in a dark environment that was cool, in other words, not exposed to temperatures over 85 degrees for any long period of time, I think, Lisa, they're just fine, and I would still use them. She also asked, "I have an infrared sauna that I use once per week, about 35 minutes. I set at 125 degrees, and I usually start sweating between 12 to 15 minutes. Do you recommend trying to get more weekly sauna sessions in?" Yes, I do, because the Finnish research really indicates that 3 to 4 times a week shows the tremendous all-cause mortality reduction into the 70+% reduction of all cause for death. And that's closer to 4 times per week. A lower, higher temperature, a shorter, longer time. Also, is there a correlation between our health and how long it takes us to sweat? My husband usually is sweating within 5 minutes of entering the sauna. Thank you. No, I think if a woman goes in there, and remember, men have more muscle mass, and with more muscle mass and their heart beating, they are going to have larger mitochondria, a higher metabolism, production, energy production. They'll sweat sooner. They always will. So women sweat slower. So don't feel bad about that, but I would increase just the frequency of doing this. Now, you're getting benefit from any sauna, so don't say, I can't do it 4 times a week, therefore I won't do it. Uh, please do it. And if you can work yourself up to closer to 4 times a week and the same amount of minutes, 20 uh, to 35 minutes, I think you're doing excellently, Lisa. Temperature wise, um, you could bring the temperature up, I think, a little higher, maybe 140 degrees, 145. But I think overall you're doing a good thing. Cynthia says about plastic in our food supply. I only use glass or ceramic plates. Excellent. Cups and store leftovers in glass. Excellent. Will it reduce plastic transfer to food if I transferred purchased food from plastic packaging to glass jars once home? The answer is yes. And I don't have a microwave. I will never microwave. I won't microwave. I don't microwave. So never do that in a plastic thing, ever, ever, ever. Is it possible to package vitamins and food supplements in paper that can be transferred to a glass container once received? Um, I think that's the whole idea, that if you keep them in a cool, dark environment sealed, there's not going to be really any interaction there. Um, and so that's what I would say there, Cynthia. John says, after reaching a core temperature of 101 degrees Fahrenheit in far infrared sauna, does taking a cold shower inhibit or compromise the body's ability to continue producing heat shock proteins? To the best of my knowledge, John, no. In fact, it is another immune benefit to take cold showers afterwards. So, but I'm going to do something. I'm going to leave this planet some decade in the future, and I will never do cold showers. I just won't do that. Sorry, it's not going to happen. All right, but yes, the answer is a cold shower will not compromise anything. It will not reduce your body's ability to make heat shock proteins. In fact, a cold shower afterwards actually is known to be beneficial. Okay, John, Victory. Okay, hello. A year ago, after I had COVID, I ended up in the hospital, and for 2 days and 2 nights, they were not able to stabilize my heart. It was atrial fibrillation. When I got out of the hospital, I was given two choices by the cardiologist: to be on medication for the rest of my life, and he's telling me about Eliquis, a blood thinner, and Multaq, which is a medicine for controlling the cardiac beat. The other thing is ablation. Ablation is a procedure where they go into your heart and they find the site in your atrium or the lining of your heart, because your heart is a muscle beating, but it has very unique nerve conducting type cells that auto depolarize and create this little electrical beat. If you burn a little spot, like cauterizing it, then that can block it. So this really isn't a question. It's more of a statement that is making. Please let me know if there are any other options, especially if this heart condition is treated at Tustin Longevity Center. Well, what I would say is this: so many things, Victory, come into play, and that's your whole, your age, your background, medical history, what other medicines you're on, how physically fit you are to start with or not, what your weight is, your body mass index, what your stress test, your coronary artery calcium score is, what your blood sugar is, your fasting insulin, your triglyceride level, your HSCRP, your sedimentation rate, many factors, along with your free T3 thyroid function, how well hydrated you are, all these things matter, but other things they'll never do is look at how much aluminum, how much mercury, how much lead, how much cadmium, how much arsenic, these heavy metal toxins that we bioaccumulate over time. It's in our food, it's in the air we breathe, it's in the chemtrails that are in the sky falling down on the land. It grows up into our food, it gets into the water. And we only, like a balloon, we bioaccumulate this. These metals misconduct electrochemical signaling. And this is well established. And we know that the National Institutes of Health did over 10 years a study on chelation therapy that looks at microcirculation and improving the circulation throughout the whole body, not just the heart muscle. So EDTA chelation therapy would be a direction I would head, along with looking at lifestyle, lowering the sugars, getting the enzymes back in, getting some modest exercise, maybe get a rebounder, making sure you're well hydrated, good night's sleep. You can get on your medicines such as the Multac and the Eliquis while you're repairing your body. And as you get healthier and better microcirculation, and we are monitored with your cardiologist and ourselves, your rate of going into AFib, or if you have chronic AFib, if you go back into regular rhythm from time to time. We have many people who get off of Multac and Eliquis, and they get out of their AFib, and they live a normal, healthy life. And then they do about 30 IV chelations, EDTA, calcium EDTA, and with healthy lifestyle and certain nutrients and enzymes, we see great improvement. Now, if you go onto the YouTube and you look at a YouTube that is titled TACT Update 2019, Dr. Lamas, Lamas. And TACT means TACT, all capital letters, Trial to Assess Chelation Therapy. So TACT, TACT Update 2019. And so this is a couple years back where the head cardiologist is reviewing some updated, because they did Tech Trial 1, then they did Tech Trial 2, then they did Tech Trial 3, and they're ongoing, almost done with Tech Trial 3 now, and all the results are fabulous for circulation. So you don't have to be afraid of being on your cardiologist recommended medicines. You can work with doctors who will try and help improve your overall health to the point that maybe you can get off, maybe not. Now, on the other hand, could you do ablation? I have seen people successfully receive ablation therapy, but I tell you, it's going to come back if you don't change your lifestyle and do chelation to reduce the heavy metal toxicity. One of the ways I like to describe it is, if I went to your box on your house that has all the electrical units on it, where all your breakers are, and I opened it up, and I took the dust of aluminum, and I opened the box up, and I blew in a bunch of dust of aluminum, and I closed the box to your breaker on your house. I bet you your lights will flicker and go on and off or go haywire. So you have to think about that. If you go to that YouTube Tech Update 2019, DR, meaning doctor, and then his name is Lamas. When you get that, it's a 15-minute video, and right underneath it, you're going to see a picture of a woman called Dorothy Merrick, and a 1-hour video, which is the all-cause mortality of death cut in half, basically, by those of us who do chelation therapy. I would watch that one too, because Dr. Lamas just talks about the heart benefits, tremendous things he's seen, and now he's a convert to doing chelation on his heart patients. Whereas Dr. Merritt and I, we teach chelation therapy for all-cause mortality, and that is a blockbuster video of hers right beneath his. It always shows up together. Let's see, what's the next one? Christine, is there anything that a man that is undergoing hormone treatment for prostate cancer can do to mitigate the side effects. One of which is extreme hot flashes. Well, I think we already answered that. The dong quai, the black cohosh, the ashwagandha, the magnesium, the vitamin D, the potassium, calcium, the melatonin. All these things are very helpful, along with all those healthy lifestyle recommendations and lots of water. That would be my recommendation. The last one of my email says by Carolyn, I submitted this question last week, but too late for you to respond. I did want to elaborate on the details. I have rheumatoid arthritis. I follow a paleo anti-inflammatory diet, no gluten, no dairy, no sugar, or low sugar. I exercise and see a physical therapist twice a week. Take supplements as I can afford them. I meditate, do yoga. I use an Alpha Stem M device for pain and inflammation. The only rheumatoid arthritis medication that I tolerate is Plaquenil. That's hydroxychloroquine. I have had my diagnosis since 2011. Started the diet in 2014. My inflammatory markers are all within normal range currently, but I am developing some deformities, erosions in my toes. I also have shoulder pain that will only resolve with cortisone injections. It seems to become irritated and painful every 2 or 3 months. I have wrist pain off and on and arm developing erosion in one wrist. My rheumatologist is going to start offering low dose immunotherapy. Are you familiar with this and do you have an opinion? Yes, if you're doing all these healthy things, that might be an option to go with. But it's not covered by insurance, would be out of pocket. Do you have other suggestions? I feel as if I'm running out of options and do not want my joints to undergo any more irreparable damage. Thank you. Your joints have to have circulation too, and you have to know that joints have cartilage, and cartilage is the cushion, and then the tendons, and there is a synovial artery, a capillary, that is the only blood supply to a joint space. And if that little artery gets clogged up, the joint breaks down and just dries up, cracks up, and falls apart. So chelation therapy is a good concept. Remember, all cause of death, mortality is improved when you improve the circulation to every part of your body. The other thing is adequate water. The other thing is natural hormone replacement therapy is an aid to stimulating growth and repair in a healthy way, even to the muscles and cartilage and tissues. And you could also use some natural testosterone therapy, DHEA. And the other thing would be having a very good weight resistance muscle training under the supervision of a trained, muscle personal trainer to help build up your range of motion and your muscle tone of the pelvic girdle and your shoulder girdle here. Your deltoids and your biceps and your lats behind and your trapezius in the back. So this is a whole muscle system. Range of motion and water and enzymes and hormones and low carb and natural hormones and testosterone for muscle mass stimulation, intermittent fasting to stimulate autophagy to repair. These are other considerations that you might consider to be a help. There are joint injections with things like hydrogen peroxide, ozone, B12 with hyaluronic acid. There's prolotherapy injections in these joints. So there's lots to talk about. I would see a well-informed functional medicine doctor and look at some of these potential things to help you, Caroline. So that's where I would go with that. You got to eat enough protein too, and healthy fats. taking some linoleic alpha-linoleic acid, using the clinician's preference oil that I talk about, or the capsule. These are the same thing. That'd be the capsule form of it. And that's what I would do there. Now let's see what we have on some of our questions on the side here with our last minutes. Rosa Morales says, Happy New Year, Doctor. My brother has been sick for 3 to 4 weeks with the flu-like symptoms, not sure of COVID. Would you benefit from ivermectin? I would say the answer is yes. He has been vaccinated. So I would definitely see a doctor, your healthcare provider, ask him if they would consider letting him go on, 7 to 10 days of ivermectin according to his weight, 0.4 milligram per kilogram. Typically, a 200-pound man is somewhere in the realm of 18 to 21 milligrams a day for 10 days. And then I would keep him on twice a week for the month thereafter. I would follow him up. I would get his vitamin D level up using the 50,000 international unit like we have here. And I would use one a day for 5 days. And then I would stay on the 10,000 to 15,000 one a day. I would take TLC multi-mineral that gets the zinc level up. That's 3 a day. And then I would probably take a scoop of vitamin C drink every day. I'd be low carb. I would never eat late. And I would skip breakfast always and only eat between noon and 6 p.m. You would know in the first 2-3 days that he's getting better. But, what is his age? What's his other medical background? Systemic enzymes help the achiness of that. Drinking enough water helps the fluid. And if he could do a little rebounding, even feeling under the weather, if you could get on there 3-4 minutes, just bouncing, watching the news or the TV, then get off and rest and relax and get on it again. 3-4 times a day for 2-3 minutes would help move the lymph tissue. Those are suggestions I would make in general, Rosa. Zach says, what are some good foods, vitamins to support heart health? I've been having some sharp heart pains recently. Well, heart health is multifaceted, and it depends on your age, Zach, and sharp chest pains are usually non-cardiac. More knife-like stinging sharp pains are related more to musculoskeletal chest wall and or the gastroesophageal junction and reflux. So I would, in general, with that kind of a story in an otherwise healthy person, I would suggest taking some GlutatShield or Glutagenics, which is a glutamine-based powder. And I would mix a scoop of that in 6 to 8 ounces of water. I would drink it first thing in the morning, last thing before bedtime. I would have it wherever I spend most of my day in case during the day I get any sense that I'm full or having any trouble digesting. That will stop acidity in case this is from the gut. The other thing would be I would do fasting. That's an anti-inflammatory. So if it's chest wall musculoskeletal, doing some fasting will always reduce inflammation. Just stop eating for 1 day and drink, maybe chicken broth, beef broth, and water, and just see if you just stop eating food and just have the broth, not bone broth, just the clear liquid chicken broth or beef broth if you've never fasted before. And then the other thing is low carb. Low carb will always be a heart healthy thing to do. And other heart supplements, would be, the statement should be, I don't know your age, Zach. I don't know if this sharp pain, you need to be seen if this doesn't clear up. But in general, sharp is not cardiac. But if you're concerned, you should see your healthcare provider or go to urgent care. I don't know what your age is or what other medical or medicines you may or may not be on. but in general, it doesn't sound cardiac. So to have a good heart health, doing some aerobic and doing some weight training at least 3 times a week would be wise for heart health. Coenzyme Q10 is primarily and very highly needed by heart muscle tissue. I would have my testosterone level checked. Testosterone levels need to be up enough. And the other item would be the heart is always working. And so B vitamins for stress, a good methylated B complex is always heart healthy, and it helps to lower homocysteine. Things like Juice Plus have been studied by the Journal of Cardiology publication and shown to be very cardioprotective as an antioxidant from low oxygen stress. So magnesium is very important for the minerals of the heart. Now, I can make an argument for potassium and all the others, but in general, these are the major thematic ones. So Zach, look down these roads, see your doctor, and address these, and don't put them off, address them. Let's see, RMJ, how much melatonin do you recommend for sleep? You know, it's very variable. Over the many years, decades that I've been using melatonin, I find some people go to sleep very nicely with 1 milligram. I know some people that need 15, 20 milligrams. And so it's so variable, RMJ, but men tend to need more. Women, as a general rule, need less. It seems to be very helpful in flu situations. It's a powerful antioxidant. It has many other functions in the human body. So I would say find a good supplement that has 1 milligram in it and play around with just 1 or 2 milligrams, 3. If you're not getting a good night's sleep with that much, then look for a supplement that has 5 milligrams in it, and then play with 1 or 2, where you're going from 5 to 10, and just find that sweet spot for you. Deborah Vishulas, hi Debbie, my sister. What are the benefits of using liquid essential fatty acids topically on skin and areas of itchy type skin areas? Thank you, and I miss you. Oh, weren't we going to do a phone call in the evening yesterday, Debbie? I was going to talk with you and our sister Sandy. I forgot all about that. So please, if it isn't too late on the East Coast for Sandy to talk, let's do it tonight. But let's talk this week. But anyway, why do I use the liquid form? Because every cell membrane here is a double layer bilipid phospholipid layer, and when it has an injury like here, and you put that oil on it, it helps with the actual membranes. Once again, if I show you this picture here that I have on my wall, this right here is a double membrane right here. And here is a protein that is a transmembrane protein receptor. But the fatty acids that hold these things into place are right here, and right here. Here's cholesterol, cholesterol, cholesterol. These are phospholipids right here. Notice how they're uniform like this, these fats. This is the polar end. This is the fatty, fat-loving, and this is the polar end. So the world is out here. The inside cellular world is here. You have to have these fatty acids, and that's exactly what this oil is here. And this oil, you have to keep it cool. You can't let it get old. Now, this is what I use for demonstration. I've had this probably 5 years sitting here, so I wouldn't use it anymore. By now, it's oxidized. But essentially, opening up one of those capsules, you could take, the same thing and pop open a capsule onto an itchy thing, and it helps quickly to heal this need for the skin to have these fats right here that are having these very special double bonds here, double bonds here, double bonds here, double bonds here, as opposed to no double bonds right here. See, these hang, but if you have double bonds, it becomes unstable. But that electrochemical reaction helps hold the protein in, because the protein itself is so full of extra hydrogen sulfhydryl groups that the double bonds in the fatty acid here are looking for these sulfhydryl connections to share extra hydrogen where it's unstable at that double bond. So it's a perfect design, and it's like falling in love with a boy and a girl, and the fatty acid finds the double bond, finds the sulfhydryl in the protein molecule, and then they kiss and they stay hugging all the time, you know. And this is what you get when you eat your meat and your chicken with the skin on it, and your fish and your egg yolks and all these wonderful things. So we need this, Debbie. And let's see, the last one. Leah Jimenez. Okay, are EDTA suppositories as effective as the IV chelation? I'm going to say I'm the only doctor, I think, on the planet that has ever done research on this, published on it, done clinical human trials, did the animal pharmacokinetics with our team here, and saw that actually our formulation of making that suppository was very effective in absorption through the rectum. It's about, it's the most absorbed pharmacokinetic working suppository delivery for any medicine that's ever been delivered. However, it is not at all as powerful as the IV, because the IV goes right into your vein. Nothing can reach what an IV can do. But up to as much as 30%, 30-some percent was absorbed, well over 30%. So we said 3 suppositories is roughly equal to 1 IV. Since then, the pharmacy we use that makes it doesn't make our kind of suppository, so I have no control over the quality of it right now. You're going to get some benefit, and so, but there is no replacement for the IV. But EDTA suppositories are maybe the next best thing. Deborah, yay, I want my EFAs to hug and kiss, all that stuff you said. Love you. All right, love you too, Debbie. Love all you TLC Health Freedom Tribe, and thank you for being here. If this is a help to you or a benefit, please like and subscribe. Please share this with others. And we'll be here every Tuesday at 6 o'clock in the evening. And I will take your email questions at the link down below here, which is Talk to the Doctor every Tuesday night, 6 to 7. And then, or on the chat here. And this is for you because you matter. And every good thing you do has a good benefit to give to you. And we're here every week to support you in that truck. I'll do the best I can to answer your questions. I don't know everything. Only God knows everything, but He is who I call upon every day for help for me. Along with all the wonderful doctors we have here, we say Happy New Year and take good care of your health. Thank you for showing up. Bye-bye.